within the council, we're continuing our work at the moment to drive the message home about prevention of the spread of COVID-19 virus within the city and our community within the city. And with the rise in the number of cases that we're seeing currently, again, since lockdown ended and has been relaxed, and as we heard from the Prime Minister Boris Johnson last night, in fact, there obviously can't be any let up from us all in relation to playing our part in this and ensuring that infection rates are prevented from rising further. So with this in mind, we thought it was an ideal opportunity within our team to run this webinar session today and ensure, because obviously we've also got a rise in the number of private sector tenants coming back into the city at the moment as well, private rented sector tenants, particularly the student community, as I'm sure you're all aware. So we've got large numbers of occupiers coming back into the city, and we felt it was a good opportunity to hold the webinar event and cover some of the important areas in relation to the virus itself, infection control within homes, in the home setting, including rented accommodation, obviously, as people's homes, and also just to draw attention to some of the guidance, the raft of guidance documentation, and some of the specific guidance that's available out there to all of us to help us all to play our part. So we've got Alex Kite, a principal environmental health officer within our team, who some of you may well be familiar with from attending a landlord training session with us previously. He's going to be running through our slide presentation this morning, and he's going to be covering the topics that were actually provided within the invite email that and reminder emails that came out to you all. And as I said, we're going to try and sort of keep the session to an hour in length maximum. The recording is going now, so there will be a link available to the recording, which we'll ping out after the event to everyone who was invited to attend. And what we will also do is, towards the end of the session, once Alex has delivered his presentation, we will allow some time for questions. We did ask on the invite for people to submit any questions in advance if they were able to do that. We've had a couple of those come through to us, so we'll look to cover those. And also, if anyone didn't get an opportunity to raise a question that they have before the session, then please do add it to the chat on our team session here. And if anyone's not familiar with how to do that, then there on the toolbar on your screen, there is sort of a little speech bubble icon. And if you click onto that, it will bring up the meeting chat at the side of the screen, and you can get an idea of other people that have joined our session today, and you can also type in a message there, a question for us that we will look to cover towards the end of the session. Any questions that we don't get time to cover, then we are looking to put out a frequently asked questions document to everyone again who's been invited to attend the webinar today. And also we will look to publicise and make that document more widely available by adding it to the Cambridge City Council website as well. So we'll give everyone details of that after the session, and they will follow in due course. So I think that's everything from me as an introduction. So without further ado, I'll hand you over to my colleague Alex to do the presentation, and I hope that everyone enjoys the session and gets some useful information from it as well. Thank you. Over to you, Alex.
Good morning. Thanks, Claire. So before we get going, I'm just going to say, when we send out the email, along with the link to this presentation and the frequently asked questions document, we're also going to send out this PowerPoint as well. So as we go through this presentation, there's going to be a number of links to other websites, and they'll appear as blue text that are underlined in the PowerPoint. And if you click on those, that'll take you to the further reading and guidance that we provided throughout the presentation. And as Claire mentioned, at the end, we'll also be talking through some of those FAQ questions. So moving on, my name is Alex Kite. I'm a Principal Environmental Health Officer with Cambridge City Council. And we're here to talk a bit about COVID-19, which I'm sure you're all aware of by now, and how it affects you as landlords. So first, I'd like to talk a little bit about what is the coronavirus. So there's a lot of different names banded around: the coronavirus, COVID-19, SARS-CoV-2, and it sort of all relates to the same thing, but there's some slight differences. So the specific name of this virus is known as SARS-CoV-2, and that basically means like the second SARS coronavirus, SARS like coronavirus, because and the word coronavirus, that relates to the family of viruses to which SARS-CoV-2 belongs. The collection of symptoms associated with this disease from this virus, that is known as COVID-19. So SARS-CoV-2, this virus belongs to the family of viruses such as coronavirus. Now, other viruses that exist in this family are SARS, which stands for Severe Acute Respiratory Syndrome, and also MERS, which is Middle Eastern Respiratory Syndrome, both of which are far more lethal than the coronavirus, but far, far less infectious. And of course, the simple common cold is the most common member of the coronavirus that we're all familiar with. So the main way the virus spreads is through contaminated surfaces. Although it is airborne, its contaminated surfaces are the most likely route for someone to become infected. Now, when we breathe and we speak, there's water droplets that go along with our breath, and these water droplets, they carry the virus. And when we breathe out, we can directly infect someone if they're close enough, or just by simply breathing out, that can then fall onto a surface and then it's then contaminated. In addition to our breath, other bodily fluids also carry the virus, such as blood, urine, etc. Like any virus, the coronavirus has an outer membrane made of a lipid. Now, a lipid is basically a fat. So when you use a detergent that dissolves fats, such as soap, washing up liquid, or the detergents used when you wash your clothes, that will destroy the virus. And that is why good basic hygiene is so important, because it destroys the virus. So actually, before I move on to controlling the risk of infection, I'd just like to say the reason the coronaviruses are called coronaviruses is because of the corona or crown-like spikes that appear around the edge of this family of viruses when you look at them under the electron microscope. That's where the name comes from. It's nothing to do with Corona beer, as some people believe. There's been stocks and stocks of Corona beer not sold because of that unfortunate link to the name. But it's just down to how they look under the microscope. So Alex,
sorry to interrupt. Could you just make sure you move your slides on your presentation on the screen, please?
Does that not come up?
It's not moving them on for the audience.
Okay. Hang on a minute.
And put it into presentation mode as well, Alex.
Was it in presentation mode before? Like, can you? Is that in presentation mode now?
That's it. Thank you, Alex.
Does that move it? Has that moved for you as well?
Yep, that's absolutely fine.
Okay, good. Right, so reducing the risk of infection. So hands, face, space is the government's three-word slogan for this, and I'm sure you're all very sick of it. But these three cornerstones of good hygiene do make a big difference. So hands, washing your hands, hands contaminated with virus particles is the main way the virus is spread. That's why washing your hands is so important. In addition to that, good basic hygiene for clothes washing and cleaning surfaces in common parts is also essential in reducing the risk of contamination. The face coverings that we're being told to wear inside certain shop settings and other public spaces, they ask to reduce the viral load that you eject into the air every time you breathe or speak. I mean, obviously, they're not going to be 100%, but they do make a massive difference, particularly if you're in an indoor setting. Over time, if enough people come in, breathe, and speak, and they don't wear a mask, you're going to have a significantly higher viral load in that air than if everyone wore masks. So they might be uncomfortable, but it's well worth continuing to wear them. In terms of distance, again, if you're speaking to someone, that ejects a column of air from your mouth containing moisture and virus-laden particles. The closer you are to someone, the more likely they are to breathe that in. And also, the closer they are, the more likely to breathe in a greater viral load. So again, it's all about reducing the viral load, and it means reducing the likelihood of you infecting another person. So those are the main things. They're the basic things, but they really do make a big difference. So whenever you're managing a property, these are the things you want to be stressing to your tenants and any guests to the property. We'll come on to a bit more about that later. Self-isolation. Now, this is now become law. It was guidance, now it's a legal requirement. And basically, anyone who has symptoms of COVID-19, which is a high temperature, new and persistent cough, or losing your sense of taste or smell, which is known as anosmia. If you have any of these symptoms, then you must self-isolate for at least 10 days from when the symptoms started. Or if you received a positive test result, then you also need to self-isolate for 10 days from the date the test was taken. So if you tested positive, but you did not experience symptoms before the test, but then you do go on to develop symptoms, then you should restart the 10-day isolation period from the day the symptoms developed. Now, if you have a tenant and a property who's self-isolating, then the government guidance on self-isolating, which if you click on the link at the bottom, it does state that the other tenants must also self-isolate for 14 days. The reason for this is that there's a very different definition of a household in terms of HMOs than there is in relation to outbreak management. So in terms of outbreak management, a household is simply classed as everyone who lives together in the same accommodation and they all share the same facilities. So basically everyone in a house of multiple occupation, or a HMO, that is termed as one household for the purposes of outbreak management, which is different to how we normally class a household in terms of HMO licensing, for example. So this is now a good opportunity to talk a bit more about the difference between self-isolating because you've had symptoms or a positive test result, and quarantining because you've come back from abroad from a country and you now have to quarantine 14 days. So if someone is self-isolating because they have symptoms or positive test, the other tenants should self-isolate for 14 days. However, if someone's returned from abroad and just quarantining, the government guidance states that the other tenants do not need to self-isolate as well. Okay, so that's quite an important distinction. Now, managing COVID-19 in your property, it's not going to be an easy task, but you should definitely try because it will make a big difference. And it's probably inevitable at some point you'll have at least one person be self-isolating in your property and you need to know how to respond. So talking with the tenants regularly and making sure that they check any visitors who attend their premises to make sure they don't have symptoms, and anyone who's feeling unwell shouldn't be entering the property. There is advice on tenants living in shared accommodation on our website, and that gives lots of detailed information on how to. I can bring this up. Where are we? So we have a web page here, and there's the hands, face, space, and we have lots of different advice on living with coronavirus. We also have these information leaflets, which we're going to be giving out with the email at the end of the training. So how to stop the spread of it at home. For example, good cleaning, distance, and face masks, what to do if you have symptoms. It also gets to the practicalities of living in shared accommodation. So, for example, you might want to encourage your tenants to develop a rota so that anyone with symptoms goes last, and then they clean the facilities after them. So, moving back on to the training. If someone is self-isolating and they don't have any friends or family in the area to help them get shopping, or they can't do an online shop for whatever reason, there is support from the NHS Volunteer Responders Programme, and tenants can also call this 0808 number and ask for help with food, prescriptions and essential items. So there is support out there. So that's one thing to perhaps share with your tenants, is where to get support from. That's something that would really make a difference to them. And you're only going to know if they need support by keeping in regular contact. I mean, you don't want to be harassing them every day, but letting them know that they can talk to you, and that it's safe for them to tell you that if they're self-isolating. And if someone is in quarantine, then or self-isolating, then you encourage the other tenants to clean the surfaces and wash hands more often. You might also want to consider maybe getting a cleaner to clean the common areas. Leaving the windows open also helps to ventilate the property and therefore reduce the viral load in the air. And the other thing to bear in mind is many houses in multiple occupation have large numbers of occupants living inside. For example, many are already at 6 occupants. Bearing in mind the latest restrictions of any gatherings of more than 6, whether inside or outside, being banned, if you have a 6-person or more HMO, this unfortunately means that they are no longer allowed any social gatherings. So, for example, you might want to perhaps discuss that with them and let them think of alternative arrangements to see their friends. For example, leaving the house so it's just one person and another friend in a park, for example, in a much smaller risk setting. So there's lots of good guidance on cleaning from both the government and the HSC, found on both of these links, how to do the cleaning properly. If I bring these links up, you can see a bit more about it. So where are we? So this is the HSC guidance on making your workplace COVID secure, but it's also got good advice on how to, wash your hands, surface cleaning, etc., and also making risk assessments. Now, if you're a landlord and you want to make a risk assessment of COVID-19 in your property, I would say this is probably one of the best places to look, because the HSC specialise in risk assessments. So consider having a look at that link if you want more information about making a COVID-19 risk assessment. The government advice on cleaning covers, thinking about what's going to be contaminated, the amount of virus shed from the individual surfaces to clean. It gives you general principles of how to clean, what to use, where to clean, for example, like door handles, light switches, work surfaces, frequently touched surfaces. And it also recommends wiping down twice a day as a minimum. So, for example, if your tenants don't agree to this cleaning schedule, then you might maybe want to consider getting a cleaner in. So there's also what to do if someone in the property has symptoms of COVID-19. So then the cleaning might want to be done by someone wearing PPE. They might want to make sure they've got the correct disinfectants. It also describes about not mixing cleaning products together, as that can create toxic fumes. It discusses about laundry and waste. In summary, plastic bags, double bag it, and then if you leave it for 72 hours, that's pretty safe then. It's unlikely to have any viable virus inside it, as tests have shown that within 48 hours, pretty much most of the virus is no longer active. So going back to the PowerPoint. So yes, just basically bear in mind that surface contact is the main way you will become infected. That's why surface cleaning is so important. And this, a cleaning rota might make quite a difference. Now, actually, before I move on to repairs, if I can quickly move on to our FA frequently asked questions document. One of the questions was about what can we do as a landlord HR manager? Just quickly, there's various posters that I mentioned before from the county council. You might want to consider leaving these up around your property for tenants to look at, either in the kitchen or communal area. That's one thing you can do. What to do, symptomatic, how to clean, for example. And then, as mentioned on the frequently asked questions document, so I'm not sure if that's showing on the screen or not. There's links to the county council website and where to access more posters. So you might not want to use all of them, but a lot of them are very useful and they're all for free. So repairs and maintenance. So obviously everyone wants to still maintain and repair their property. And if no one is self-isolating in the property and you've confirmed that no one is symptomatic, including the contractor, then it should be safe to continue to do so. Now, there is guidance from the government for professionals working safely in people's homes, and they should be following that government guidance. The contractors themselves should be carrying out their own risk assessments before they enter the property. And if you're in an unfortunate situation where someone is self-isolating, and therefore, in effect, the whole household should be self-isolating, but you have an emergency repair job that you're attending to, then the contractor would need to ensure that they have sufficient risk assessments and PPE in order for them to work safely, and that any self-isolating person should remain in the room and away from the area where the contractor needs to visit. I mean, I would stress that this is really for emergency works. If it's non-essential, I think these kind of works should probably wait until the end of the self-isolation period, which should really be 14 days. So if you have an unfortunate situation where you have a long hauler where someone has ongoing symptoms for months, then you should treat it as though it's self-isolating, and risk assessments and PPE should be used because they may well be infectious during that time. So moving on to coronavirus limited accommodation, as well as the government advice on contractors working safely in accommodation, the government has released guidance for both landlords and tenants on COVID-19. So if I quickly go to this, to see if I can bring it up.
Need to make sure that's visible on our screen, Alex, as well.
Right, bear with me.
Share it fully. Yeah.
Okay. So this is the self-isolation guidance. Bear with me. Right, here we are. So this is the guidance for landlords, tenants, and local authorities. So there's a lot on this page. The guidance for landlords and tenants gives both advice what to do. There's also, for landlords, you might be more interested in the technical guidance on eviction notices. So we're going to talk more about that in a slide or two, but that's the source of information for how to carry out an eviction during this time, which is a lot more difficult now. Basically, if you click on the landlord and tenant guidance, it gives you advice on rent, mortgage payments, what help you can get, how to safely carry out repairs and maintenance, and what to do about rent arrears. These are difficult times, but there is support out there, and if it's there, it's going to be found on the government website. So this is where I would advise you to look if you're in difficult times. So these are all good information sources, especially if you're having difficulties with your mortgage, which we'll talk later on in a minute. So moving back to the presentation, bear with me. So the main three parts of the guidance for landlords and tenants, it relates to notice seeking possession and how they've been affected by the Coronavirus Act 2020, court action on possession cases and how that's changed, and also your health and safety obligations, repairs and inspections in the context of COVID-19. So if you're in any doubt or whether you should or should not enter a property, I would check the guidance first. It gives pretty detailed scenarios and what you should do. So evictions. This is probably a bit of a hot topic for most landlords because the ban on evictions was extended until the 20th of September. That's now passed, so you now can apply for possession proceedings to the county court. However, you've now got to give the tenants 6 months notice rather than the 3 months they were asking for. So it's still going to take a long time for you to successfully evict a tenant from a property. And the eviction cases that will be prioritized will be those dealing with serious issues such as violence or antisocial behavior, and those are the cases the courts will be prioritizing. The government advises landlords that if tenants are having difficulty paying rent, to please not issue a notice seeking possession, and that to try and direct them to support. They might be eligible for universal credit or for some type of employment support. The furlough package was supposed to be wound up in October. Bearing in mind Johnson's comments last night, they may announce further measures from the Treasury. We just don't know yet. But as soon as we know, we will update you and update our website. So moving on to rent arrears. Now, there's a lot of different advice services out there for tenants and landlords, such as Shelter, Citizens Advice, the Money Advice Service, Legal Aid, and Civil Legal Advice, all for free and confidential advice. And like I mentioned before, there is government support for employers and employees, and both landlords and tenants might be able to benefit from that. In addition, now that self-isolation has become a legal requirement, local authorities have been asked to administer government funding of £500 for those on a low income who are self-isolating. As this has been a very, very recent announcement, we don't have the full details of that yet, but once we do have more information from central government, we will update our website with that information. So keep checking our website. Mortgage payment holidays are available for landlords up until the end of October. That may be extended. It may have different terms attached to it. We don't know yet. But currently, the scheme means that you don't get away with not paying anything, unfortunately. It just means the missed payments will be added to the cost of your mortgage, which ultimately means in the long term that your monthly payments will increase. So I understand that many landlords may not want to take that option up, but it is there if required. And who knows, maybe the Treasury will revisit the way they're doing things and there might be something different. Again, as soon as we know, we will update our website and provide that information. And that's coming towards the end of the presentation. Now, here we have a list of useful links. There Domestic Advice Housing Alliance website, which specialises in domestic abuse, how to spot it and help those victims of it. They have a lot of good advice about COVID-19 for housing providers, but also a specialist guidance if you suspect a tenant is a victim of domestic abuse. That's definitely worth checking out. If I quickly jump to that website. Right, can everyone see the website okay? Hope good. So mainly it is focused on domestic abuse, but there's lots and lots of advice on general coronavirus measures, support services, which is always useful to all kinds of tenants. Lots and lots of useful links there. Now, also other links on the PowerPoint were a link to the County Council's website. Now, since I've got my web browser up, I'll just go to that directly. So the County Council website has lots of different information about how coronavirus affected their services, coronavirus scans, which is now unfortunately a thing, how to get help from your community, information for residents, support for businesses, information on test and trace, information for shielding people, and there's also coronavirus campaign materials. Now, this was the page I mentioned before about where to get posters from, and there's lots of different things here. There's posters and leaflets that you might want to put up in your property. There's videos about controlling the virus. You could simply provide this link to your tenants, for example, if you wanted to. In addition, there's our own website, which has good advice about the coronavirus. Plus, we're going to update it after this webinar with details on how our services have changed, and also if there's any updates in legislation or guidance from the government, we'll also put that on the website. I hope you've enjoyed this webinar. We're going to do a bit of question answering after this between Claire and myself. And if you have any questions or constructive feedback, we'd be very grateful if you could please send it to the following email address, which is projectresidential@cambridge.gov.uk. And if you like this webinar, and we may do more in future, please let us know. And if there are any topics you would like us to cover, then please let us know. And over to Claire.
Thanks, Alex. As you can appreciate, obviously, and as you're all fully aware, the subject of COVID-19 is obviously huge, and we have literally scratched the surface with things during Alex's presentation this morning. But just going back to what I said in the introduction, and what we've heard from the Prime Minister yesterday, that it's imperative now that we all, a lot of us will have been doing it anyway as professionals. I'm obviously pretty sure about that, but it's imperative that everybody, including tenants, are doing their part as residents of the city to prevent the spread of the virus now, because we all, I'm sure none of us want to be faced with that situation of going into another more widespread, either a local lockdown situation or in fact another national lockdown situation. I'm sure that's what everyone is very conscious of, and the sort of detrimental effect that may have more widely as well. So within the council, obviously, we're working particularly in environmental health. Our manager, Yvonne O'Donnell, who some of you may also be familiar with from working with her in previously, because she did used to sort of manage housing standards a number of years ago within environmental health. She is obviously working very closely as the council's single point of contact for public health and for the county council's health protection team. So on a daily basis, you know, Yvonne is in close contact with them, the other organisations and our partners, and keeping abreast of the local situation. And in line with that, we in the other teams within environmental health, including us in the residential team, are being passed relevant intelligence information where a potential sort of mini outbreak situation may occur. Touch wood, we've been fortunate and we haven't had to deal with a large number of those incidents within Cambridge City. I know that colleagues in other local authorities have had, you know, nationwide have had obviously a lot of those such incidents to investigate and follow up on. But we are obviously keeping in touch with how all of that side of things as a council on a daily basis. And if we needed to make contact with any of you as independent housing providers separately, then obviously that would happen, and we would make contact with you as necessary. But in the first instance, if one of your tenants is displaying the symptoms and has gone and got themselves a test, which hopefully they will do if that situation arises, then NHS Test and Trace will be the first people who will contact them if their result comes back as a positive test result, and they will do that initial immediate follow-up with them to require them to self-isolate and to draw from them the information about their close contacts and their living situation, and whether they live with others in a household who will also need to be asked and be now, as of next week, be required to self-isolate. I did put a follow-up message in the chat section of the session as Alex was talking through his presentation, just to confirm that the actual requirement to self-isolate does kick in from next Monday. It's been guidance and a recommendation, a strong recommendation up until this stage, but it is becoming a legal requirement from next Monday. The other thing that I just wanted to sort of pick up on and just sort of clarify for people from the session as Alex was talking through his presentation. In terms of the virus and the symptoms, Alex did mention that if someone has got continuing symptoms, it's kind of something that's being termed, you might have heard of it in the press, as like long COVID, where they're continuing to have symptoms of the virus after having done their initial self-isolation and after having tested positive. I think it's very important to stress that I know that that is sadly the case, that can happen in certain circumstances and is happening in certain circumstances. But I think it is important to stress that in terms of them coming out of isolation, the only thing that would prevent that after their 10-day isolation, or if they're a close contact after their 14-day isolation period, would be if they were continuing to have a high temperature. With regards to the persistent cough situation and that symptom of COVID, it is being stated by the NHS that from information gathered to date, the cough can continue for a long period of time, even after the person is no longer sort of an infection threat. So the cough, if that continues, that will not be something that would mean that they would have to remain in isolation indefinitely until that cough has fully disappeared, providing they've done that initial required self-isolation period. Okay, so I'm just thinking of those circumstances that Alex mentioned about you as landlords being able to get contractors into the property safely to carry out repairs and maintenance that might be needed there. Okay. The other two things that I had to sort of touch on before we sort of move on to any questions and wrap up the session were just the fact that when we talked about possession and evictions and rent arrears, I just wanted to clarify that some of you might have already seen this, but the government did also yesterday release a sort of date period over Christmas when there will not be any evictions happening, and they will not be able to happen during that period. So they won't be giving any actual dates for that to happen over the Christmas period. I apologise, but I haven't got the date range in front of me, but there is definitely a specific date range that has been released, yes, as of yesterday in relation to that. And the other thing that I was going to just clarify was that obviously Alex mentioned that obviously the government have also stated that because of the requirement on people to self-isolate as of next week, they are asking local authorities to administer a government funding scheme for certain individuals on low incomes who are required to self-isolate, and that's a payment of £500, which, just to clarify, it is our revenues and benefits team within the City Council that are frantically working to get that administration of that scheme in place, ready for the payments needing to be issued, which I believe begins on a date in October when the actual payments will start to be made in relation to that, in early October. So the work behind the scenes is taking place on that within the City Council, and it will be that service area of the council that issue further communications about that, because obviously that won't be administered by us within environmental health. But I'm sure our colleagues will work hard to get the information out there to residents in the city with regards to how they can tap into that funding if it applies to them. Okay. So I think that was everything that I sort of needed to add in. We've got our other colleague, one of our other colleagues, Nadine Leviggers, another principal environmental health officer within the team. She's been with us during the session, and she's been keeping an eye on questions that may have come through via the chat screen. And I think Alex may have attempted to answer one of the questions that we'd had before the session during the course of the webinar as well, which related to how far do landlords need to go with regards to sort of tenant behaviours around self-isolation, because obviously we totally understand that you as landlords cannot be there to police things 24/7. So I think that's been answered in part, but we can certainly pick up on that during the questioning session as well. So I'll hand over to Nadine now quickly, and Alex and I will remain on screen as well, so that we can assist to answer those a couple of additional questions that may have popped up during the session. Over to you, Nadine. Thank you.
Hi, so just a reminder, if anyone has any questions, to use the chat function and the buttons at the top, and it should say show conversation when you're hovering over it, and then you can type in a question there and we'll try our best to answer it. As Claire was just saying, one of the questions that came in before the webinar was whether or not there was any specific points for people who manage HMOs to note, particularly given that we have or the landlords or property managers have little influence over the behaviour of individual tenants in respect of self-isolation or quarantine. And I think we have tried to cover that as best we can in this particular webinar. Another question that's come in on the chat function, and that's from Paul South, is what happens when a tenant is leaving the property during the period of self-isolation? Do they have to stop the move? And when you say they, Paul, I assume you mean the landlord or the property manager. If so, who is responsible for housing the incoming tenant and not being able to move in? And how does the landlord protect themselves from this situation? Oh, sorry, you've just gone back to me and you meant no, the tenants. Does the tenant have to stop the move? Okay. Don't know, Claire, if you want to answer that question.
Yeah, obviously, I appreciate that this is a particularly difficult one and may well crop up, particularly at the moment as well, when we've got a number of tenants. As I mentioned at the start, we've got the student population returning to the city currently, obviously. We have dealt with one similar scenario within the city, where it was more to do with kind of a private student housing provider, and they in fact did have a tenant who needed to remain in isolation beyond their checkout date, for a couple of days beyond their checkout date. And in that particular scenario, they were able to allow them to remain in that particular accommodation and support them with that, owing to the fact that they didn't have anyone else lined up to move in for another week after the checkout date. So that was kind of more of an easier situation for them to be able to assist with. I mean, it is difficult because really, you know, self-isolation does mean that people should be, as we've heard from the government, etc., should be staying at home, not going out at all, not even to get essential items. It is very much you must remain, you must self-isolate, you must stay indoors, and only exercise within your home or within a garden associated with your property if you have that available. So yeah, this is a really tricky one. And another thing to mention is that obviously our housing advice team within the City Council, our colleagues in our housing advice team do address or assist in addressing landlord and tenant issues specifically. And we were hoping to have them join with us today, but owing to the situation with the evictions ban and possession ban coming to an end, and having come to an end, they are actually caught up with some additional training around that. So they haven't been able to join us. So what we will do is we will pick that up with our colleagues, and we will, I know it's not particularly helpful to you right now during the session because I'm not able to give you a definitive answer on it and a full answer, but we will pick that up with them, and we will include the information into the frequently asked questions document that we're hoping to get out very quickly after the webinar session. Okay.
We don't have any more questions coming in. As Claire's mentioned, we will be sending out a frequently asked question sheet to everybody. And also, as a reminder, you can send an email to the project residential at cambridge.gov.uk if you do think of any further questions at a later date, and we'll try to get back to you, especially if the frequently asked questions sheet that we send out doesn't answer what you've asked for. Okay, so I think if that's it, I don't know whether or not you want to conclude, Claire.
I think I did do a fair bit of sort of summing up after Alex's presentation. So I just want to end by thanking you all for joining. I hope, as I said, obviously very aware that this is such a huge topic area and it's very hard to touch on everything in a lot of detail during an hour's session. But you know, we are there for you to contact if you have got any queries and are stuck for where to get an answer to them from. We will certainly try our very best to assist you. And I think that Alex had up at the start of the presentation our general inquiries email address for the residential team. So we've got that address available, which is the residential.eh email address. I don't know if you're able to share that again, Alex, quickly,
yep,
please, just so that people can sort of make a note of that as we're summing up. So please do make contact with the team if you feel that there's anything else we can assist you with, or that we can signpost you to as well, because like I mentioned, and like I'm sure you're all very familiar, there are a number of different service areas that operate within the council. And there's not just us, there's also our colleagues in the county council as well that we've touched on today during the session, and where the health protection team sit within the county council. So if anyone you know, needs to be signposted to anywhere in particular, and they think we can assist with that, with our sort of knowledge of the service areas of the council, then please do contact us and we will try our very best to do that. Within the residential team, we do have a duty officer on hand each day. Obviously, because of our working arrangements having changed during lockdown, we've been doing a lot of getting a lot of initial contact come to us via email, but then the duty officer has been working to call people back or reply by email where necessary to any inquiries that have been coming into us, so that we've kept the service going. So please do feel that you can approach us. Okay, and I think that neatly brings us to the end of the session, and slightly ahead of time as well, 11:56. So I hope everything continues to go okay for people, and that there aren't too many ongoing struggles for people at this time. And as I say, please do get in touch if you need to. Okay. Thank you for joining, and take care, everyone.